Welcome to Metier International Academy. One of leading academy in training nurses and nursing competitive exam as well as IELTS and flexibility training. And now we are discussing magic pill session. And today we are going to discuss very important topic from medical surgical. And most of the students are having doubts in this topic. So watch the video till the end. Definitely there is a chance for asking questions from this topic. So actually this topic I have divided into part 1 and part 2 because it is very important topic. Most of the students, they will be having confusion in few terminologies, few definition, because if you know the definition only, you can easily solve the question. Okay, so let's begin the session without wasting the time. And if you are watching the video for the first time without subscribing, please subscribe the channel. If you are subscribing, then only it will motivate us. And if you like the video, please like it, share it to others also. So the topic what we are going to discuss, it is mentioned here, that is lung volumes and capacities. Okay, so different type of lung volumes and different types of capacities we are going to discuss. Actually, this is part 1, and the next day we will be getting what? Part 2 also. So keep subscribing the channel for getting every updates now and then. So the first question is this one. The nurse would expect which pulmonary function test result in a patient with pulmonary aspiration? So as I mentioned already, key points are very important. In this question, the key point is the nurse is expecting with a pulmonary function test. Actually, there is a pulmonary function test they are doing for a patient. Okay, pulmonary function test they are doing for a patient. With the patient is suffering from pulmonary aspiration. The patient is having a disease condition like pulmonary aspiration, and the pulmonary function test is going on for that particular patient, and the nurse would expect what result? Okay, so there is a disease condition, PFT, pulmonary function test going on. What result the nurse can expect? So this is the question. This is how you have to understand the question in a single reading. Understand? So here they have given 4 options like increased lung volume, increased compliance, decreased compliance, increased functional residual capacity. Each and every important terminologies we are going to discuss in detail. Okay, so watch the video till the end. Definitely it will be so much useful for you. So here for this question, the right answer is what? Decreased compliance. So what is compliance? Why have I have selected option C, that is decreased compliance? Yeah, and then a decreased compliance and the option on the select panel. So the reason behind this is you should know the definition of compliance first. See, compliance means nothing but it is the extent to which the lung is expand. See, while you are taking deep inspiration, how much the alveoli is expanding, how much the lung is expanding. Okay, the alveoli and the lung is expanding, but the pleural space, 2 layers are there in the pleural cavity, that is visceral pleura and parietal pleura. The pleural space is getting contracted. Okay, the lung volume is expanding, the alveoli and lung volume is expanding, but the pleura is contracting, and the chest wall, that is thoracic wall, is also contracting. Both are acting in a negative way. Which two? Pleural space and the thoracic cavity, both are acting in a negative way, that is contracting. Okay, whereas the alveoli and lung is expanding. Okay, so this is called as what? Compliance. The capacity of the lungs to expand, the capacity of the alveoli to expand. Evlo on the alveoli expand avudo, lung on the expand avudo, adha on the compliance. Okay, so இந்த ஒரு கான்செப்டை கிளியரா வச்சுக்கோங்க. ஸோ லங் எக்ஸ்பேண்ட் ஆகுது, அதே நேரத்தில் உள்ள இருக்க ஆல்வியோலும் எக்ஸ்பேண்ட் ஆகுது. ஸோ லங் எக்ஸ்பேண்ட் ஆகும்போது அதை சுத்தி இருக்கிற அந்த ப்ளூரல் கேவிட்டி கண்ட்ராக்ட் ஆகுது, இந்த thoracic கேவிட்டியும் கண்ட்ராக்ட் ஆகுது. சரியா? ஸோ திஸ் இஸ் கால்ட் அஸ் வாட்? கம்ப்ளையன்ஸ். ஸோ இந்த பேஷண்ட்டுக்கு என்ன இருக்கு? there is a disease called as, so disease or symptoms like pulmonary aspiration, something is aspirated. Okay, so in this condition there might be some obstruction, so definitely the capacity of the lung is going to be decreased, the compliance of the lung is going to be decreased. So here, which is the right answer? Option C, that is decreased compliance is the right answer. Okay, hope everyone understand the concepts. Okay, so the next one more important point, the normal value also I have mentioned here, the total lung compliance of the both lungs. So this is the normal value. Okay, so memory based thing. So total lung capacity of the total lung compliance of the both lung is 200 ml. Okay, how much? 200 ml, otherwise 200 centimeter of water. Okay, it is mentioned here very clearly. Okay, 200 centimeter of water. Okay, at the same time, the compliance of the thoracic cage and the lung tissue is 110 to 130 centimeter of water. So these are all the important values you're supposed to remember. Total lung compliance value is 200 ml or 200 centimeter of water, and the compliance of thoracic cage and lung tissue is 110 to 130 ml per centimeter of water. They are asking in centimeter of water. Okay, fine. So the next important thing is other related topic which is related to this question. ஓகே, மற்ற என்னென்னலாம் டாபிக்கோ இந்த கொஸ்டினுக்கு ரிலேட்டடா இருக்கோ அது எல்லாத்தையுமே வந்து கவர் பண்ண போறோம். இது எல்லாமே இது வரைக்கும் கேட்ட கொஸ்டின்ஸ் எல்லாமே இது வரைக்கும் ஃபியூச்சர் மீன்ஸ் ஜிக்மர்ல எய்ம்ஸ் நார்செட்ல கேட்ட கொஸ்டின்ஸ் எல்லாமே இந்த லங் கெப்பாசிட்டி அண்ட் லங் வால்யூம் ரிலேட்டடா கேட்டிருந்த கொஸ்டின் எல்லாமே இதுல வந்து ஆட் பண்ணிருப்போம். சரியா? ஸோ கோல்டன் பாயிண்ட்ஸ் எல்லாமே இதுல ஆட் பண்ணிருப்போம். கொஸ்டின்ஸ் எல்லாமே ஆட் பண்ணிருப்போம். சரியா? ஸோ அந்த மாதிரி ஆட் பண்ணது இந்த டெர்மினாலஜிஸ். தட் இஸ் pleural pressure. What is pleural pressure? See, pleural pressure is the pressure of the fluid in the thin space of the pleura. See, you know that visceral pleura and parietal pleura, two pleuras are there. In between that fluid, pleural fluid will be present. The pressure which is created by the pleural fluid, it is called as what? Pleural pressure. எதுக்கு நான் தேவையில்லாம pleural pressure பத்தி பேசுறேன்? See, mainly I would like to focus on transpulmonary pressure. So that is the one which is mentioned in the third point. Without knowing pleural pressure and alveolar pressure, you cannot understand the concept of transpulmonary pressure. That's why I'm explaining about pleural pressure and alveolar pressure. Okay, guys. So hope everyone understand about the pleural pressure. The pressure which is present in the pleural cavity, which is created by the fluid that is called as what? Pleural fluid. Okay, the first point is over. The second important point is alveolar pressure. That is the pressure which is created inside the alveoli. Okay, so that is called as alveolar pressure. So the third one, what you're supposed to know is transpulmonary pressure. This is very important. This question already asked in the exams. So what is transpulmonary pressure? It is also called as what? Recoil pressure. What pressure? Recoil pressure. So in transpulmonary pressure, there is a difference between the alveolar pressure and the pleural pressure. The gap or the difference between pleural pressure and alveolar pressure. So that difference is called as what? Transpulmonary pressure. So if you are getting any question which is related to this, please answer the questions. Okay, fine. So the next very important thing what we are going to discuss is different capacities, lung capacities. Very important, guys. From here, you know, so many times they have asked the questions. Without knowing these things, you cannot enter inside the exams. Okay, fine. So what are all the different capacity are there? Lung capacities are there. The first one is inspiratory capacity, second one expiratory capacity, functional residual capacity, vital capacity, total lung capacity. So totally 5 capacities are there. All these 5 are very, very important. And there are separate formulas are there and separate values are there. All these things are memory based. You're supposed to what? Memorize it. And the definition you have to understand with the rational. Understand? Fine. So let's begin with the residual volume. Actually, residual volume is not a capacity, it is a volume, but still I'm going to explain that also. See, what is residual volume? Very important one. So many times this question asked in the exam. See, residual volume means volume of air remaining in the lungs even after the forceful expiration. After doing forceful expiration, amount of air which is staying inside the lungs. மேக்ஸிமம் எக்ஸ்பிரேஷன் பண்ண அப்புறமாவும் ஒரு அமௌண்ட் ஆஃப் ஏர் வந்து ஆல்வியோலையே, அதாவது அந்த வால்யூம் ஆஃப் ஏர் இன் த லங்ஸ், அந்த எக்ஸ்பிரேஷன் பண்ண அப்புறமா எவ்வளவு அமௌண்ட் ஆஃப் ஏர் வந்து இந்த லங்கோட பாத்வேல வந்து இருக்கு. ஸோ அதுதான் என்னது? ரெசிடுவல் வால்யூம். Once again I will repeat, the forceful expiration of air after the forceful expiration, amount of air which is remaining in the airway. Okay, so that is called as what? Residual volume. Forceful expiration பண்ண அப்புறமா எவ்வளவு amount of air வந்து அந்த பாத்வேல இருக்கு, அதுதான் வந்து residual volume. So here the value they have given, that is 1100 ml to 1200 ml. Okay, the next important topic is inspiratory capacity. இதுக்கு அப்புறமா நம்ம அந்த 5 capacities வந்து பார்த்துறோம். ஓகேங்களா? So inspiratory capacity, கவனமா பாருங்க, ஒரு சின்ன ஒரு வேர்ட் தான் டிஃபரெண்ட் ஆயிருக்கும், பட் அந்த வேர்ட் டிஃபரெண்ட் ஆகிறதால டோட்டல் டெஃபினேஷனே வந்து சேஞ்ச் ஆகும். சரியா? ஸோ அதனால யூ ஹேவ் டு லிசன் வெரி கேர்ஃபுல்லி. இன்ஸ்பிரேட்டரி கெப்பாசிட்டி அண்ட் வைட்டல் கெப்பாசிட்டி. இன்ஸ்பிரேட்டரி கெப்பாசிட்டி, வைட்டல் கெப்பாசிட்டி, இந்த ரெண்டு இடத்துல தான் வந்து ஸ்டூடெண்ட்ஸ் வந்து கன்ஃபியூஸ் ஆவாங்க. மோஸ்ட் ஆஃப் த ஸ்டூடெண்ட்ஸ் வில் கெட் கன்ஃபியூஸ் இன் பிட்வீன் inspiratory capacity and vital capacity. Please understand the concept. See, in inspiratory capacity there is one key point, that is normal expiration. Please remember this, normal expiration. Whereas in vital capacity, forced expiration. Normal expiration, forced expiration. Okay, I'm comparing inspiratory capacity and vital capacity because most of the students will get confused in it. Okay, so I have told the key point also. In inspiratory capacity, normal expiration is the key point, and vital capacity, forced expiration is the key point. So let's discuss about the definition. So inspiratory capacity means total volume of air a person can inspire after a normal expiration. See, ஒரு normal expiration அப்புறமா எவ்வளவு amount of air வந்து the patient வந்து inspire பண்றாரு. The total volume of air a person can inspire after a normal expiration. Understand? So that is called as what? Inspiratory capacity. So total volume of air inspired after a normal expiration. And the value or the formula what they have given here is tidal volume plus inspiratory reserve volume. So these things, the formula we can discuss in the next page so that it will be easy for you to understand. Okay. So now the inspiratory capacity definition is over. Okay. The next one is expiratory capacity. See, expiratory capacity means just opposite to inspiratory capacity. The total volume of air the person can expire or exhale after normal inspiration. So here you can see in inspiratory capacity and expiratory capacity, after the normal expiration, amount of air inspired is called as what? Inspiratory capacity. And after the inspiration, amount of air the person can expire is called as what? Expiratory capacity. So expiratory capacity na enna irukum? Exhalation irukum. Inspiratory capacity na inhalation irukum. Mudijiruchu. The next one is functional residual capacity. See, if you are having confusion, again and again, just go back and watch the video. Okay, so that it will be clear for you. Okay, understanding is very important. Functional residual capacity, it is very, very simple capacity. See here, the volume of air that remains in the lungs after a normal respiration or expiration. Amount of air remain in the lungs after a normal expiration. So you will be getting confused with the residual volume and the functional residual capacity, right? உங்களுக்கு உடனே வந்து ஒரு confusion வரும். Residual volume இதே தான் சொன்னீங்க. Amount of air remain in the lungs after the expiration. ஆனா residual volumeல amount of air remain in the lungs after forceful expiration. ஆனா functional residual capacityல பாத்தீங்க அப்படின்னா இதுலயும் amount of air remaining in the lungs after normal expiration. Residual volumeல forceful expiration அப்புறம் எவ்வளவு ஏர் வந்து லங்ஸ்ல இருக்கு அதான் ரெசிடுவல் வால்யூம். ஆனா ஃபங்க்ஷனல் ரெசிடுவல் கெபாசிட்டில ஒரு நார்மல் எக்ஸ்பிரேஷனுக்கு அப்புறமா எவ்வளவு ஏர் வந்து உள்ள அதாவது லங்ஸ்ல வந்து இருக்கு. ஸோ ஃபோர்ஸ்ட் எக்ஸ்பிரேஷன், நார்மல் எக்ஸ்பிரேஷன். சரியா, இதுதான் டிஃபரன்ஸ். இந்த கீ பாயிண்ட்ஸ் தான் டிஃபரன்ஸ். சரியா, இது தெரிஞ்சா மட்டும்தான் இந்த क्वेश्चंस எல்லாம் சால்வ் பண்ண முடியும். ஓகே, அடுத்து பாத்தீங்க அப்படின்னா வைட்டல் கெபாசிட்டி, வெரி இம்பார்ட்டன்ட் ஒன். as I mentioned already, mostly it is similar to inspiratory capacity and vital capacity, but only one word is changed here. Okay, that change in one word will change the definition. So understand the concept. See, vital capacity means maximum volume of air a person can breathe in after a forced expiration. ஒரு forceful expiration க்கு அப்புறமா எவ்வளவு டீப் இன்ஸ்பிரேஷன் எடுக்க முடியுமோ அதுதான் வைட்டல் கெபாசிட்டி. ஒரு forceful expiration க்கு அப்புறமா forceful, அதுவும் forceful தான். ஓகே, forceful expiration க்கு அப்புறமா எவ்வளவு டீப் இன்ஸ்பிரேஷன் அந்த பேஷண்டால எடுக்க முடியும், that is called as what? Vital capacity. It has actually two definitions. Okay, after your forceful expiration, how much amount of air the patient is inhaling, maximum amount of air the patient is inhaling, that is one definition. Okay, and one more definition is after maximum amount of air inspired by the patient and how much amount of air expired by the patient. Once again I will repeat. See, two definitions are there. The first definition is after the forceful expiration, maximum amount of inspiration taken by the patient. Okay, that is the first definition. Second definition is after the forceful inspiration, maximum amount of expiration done by the patient. ஒரு forceful inspirationக்கு அப்புறமா எவ்வளவு maximum expiration பண்ண முடியும், இல்லனா forceful expirationக்கு அப்புறமா எவ்வளவு maximum inspiration பண்ண முடியும், ரெண்டுமே என்னது வைட்டல் கெபாசிட்டி தான். புரியுதா? The last one பாத்தீங்க அப்படின்னா total lung capacity, very 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 important. Okay, so many times till now they have asked so many times this question in the exams, total lung capacity. So what is the total lung capacity? Total volume of air accumulated in the lungs at the end of the forced inspiration. Okay, so you are doing a forced inspiration, taking a deep breath. Okay, so at the end of the forced inspiration, how much amount of air remaining in the lungs? Okay, so that is called as what? Total lung capacity. Okay, so again and again watch the understanding. You have to increase your understanding capacity by watching the video again and again. Okay, pause the video, read the terminologies and understand my concept. Okay. The next one is lung volume. So far we discussed about what? Lung capacities. Now we are going to discuss about what? Lung volume. So 4 types of lung volumes are there: inspiratory reserve volume, tidal volume, expiratory reserve volume, and residual volume. Already we discussed about residual volume. I'm not going to repeat again. Whereas all other volumes like inspiratory reserve volume, tidal volume, expiratory reserve volume, we are going to discuss once again. Okay. So what is that? Inspiratory reserve volume. Very simple. Volume of air inspired beyond a restful inspiration. And expiratory reserve volume means volume which can be expired beyond the restful expiration. Very simple. என்ன சொல்ல வராங்க அப்படினா inspiratory reserve volume na maximum inspiration உங்களால எவ்வளவு எடுக்க முடியும் அதுதான் inspiratory reserve volume. expiratory reserve volume na maximum exhalation உங்களால எவ்வளவு பண்ண முடியும் அதுதான் expiratory reserve volume. சரியா? சோ அதுதான் இவங்க இப்படி கொடுத்திருக்காங்க. So inspiratory reserve volume means maximum inspiration. That is called as inspiratory reserve volume. And expiratory reserve volume maximum expiration. Okay, in a restful condition. Okay, you are sitting peacefully and you are doing a maximum inspiration means that is inspiratory reserve volume, and you are doing maximum expiration means that is expiratory reserve volume. Okay, tidal volume, you know that amount of air going inside and outside the lungs in a single breath. எவ்வளவு ஏர் உள்ள போகுதோ வெளியில வருதோ in a single breathல அதுதான் என்னது tidal volume. புரியுதா? So these things are coming under what? Volumes. Inspiratory reserve volume, tidal volume, and expiratory reserve volume. So here you can see in the image inspiratory reserve volume, expiratory reserve volume, tidal volume, residual volume. So these are all the 4 volumes. Based upon the volumes only, the capacity is there. In the volumes of which in the capacities எல்லாமே வந்து இருக்கு. ஓகேங்களா? vital capacity ஆகட்டும், total lung capacity ஆகட்டும், எல்லாமே எதை வச்சு தான் இருக்கு? இந்த volumes வச்சு தான் இருக்கு. So அது எப்படி அப்படிங்கறதை இப்ப பார்ப்போம். சரியா? So here you can see the calculation of the lung capacities. Okay, so all these things are very important, guys. You should know these things. So in the question, in the exam, they will be asking what is inspiratory capacity, what is the formula of inspiratory capacity, what is the normal value of inspiratory capacity. If they're asking question like this, you're supposed to answer, right? That's why I'm giving this much explanation. Okay, so now we are going to discuss the calculation of lung capacities. எப்படி வந்து கால்குலேட் பண்றது lung capacity? For example, inspiratory capacity ன்னு கொடுத்துறாங்க, உடனே அதை வந்து எப்படி நம்ம கால்குலேட் பண்றது அப்படின்னா very simple. See, here you can see inspiratory capacity means tidal volume plus inspiratory reserve volume, TV plus IRV அப்படின்னு சொல்லி நீங்க மென்ஷன் பண்ணிருக்காங்கல்ல. IC is equal to IC னா the inspiratory capacity, TV னா tidal volume, IRV னா inspiratory reserve volume. So இது எப்படி நீங்க கால்குலேட் பண்ணீங்க இங்க பாருங்க. So inspiratory capacity இந்த இடத்துல மென்ஷன் பண்ணிருக்காங்களா 3600 ml தான் இதோட வேல்யூ. inspiratory capacity, the value is 3600 ml. How I have given inspiratory capacity 3600 ml. See, I'm going to calculate from here to here. See, look into the arrow mark carefully. From where? From here to here I'm going to calculate. So here you can see inspiratory capacity is equal to inspiratory reserve volume plus tidal volume. Inspiratory reserve volume plus tidal volume. So by means of knowing the formula, easily we can solve this question. Okay, so inspiratory capacity is equal to what? Tidal volume. Tidal volume is how much? 500. And inspiratory reserve volume is 3100. So together it is coming under what? 3600. So this is one example. Same way, if you go for functional residual capacity, ERV, that is expiratory reserve volume plus RV, that is residual volume. Here you can see functional residual capacity is equal to expiratory reserve volume plus residual volume. 1200 plus 1200, that is 2400 ml. So total lung capacity is equal to IRV plus TV plus ERV plus RV. So these things you have to memorize it. And the volume you have to memorize, values you have to memorize it. Okay, then only you can solve this question. So definitely you should know these formulas and the values. Okay, here you can see in this the values I have mentioned. Okay, so inspiratory capacity means the value is 3800 ml. Vital capacity means the value is 4800 ml. Functional residual capacity means the value is 2200 ml. Total lung capacity means the value is 6000 ml. How I calculated this? By means of using the formula whichever I have mentioned here. The formula ரொம்ப important. Pass பண்ணுங்க, ஒரு separate ஒரு note எடுத்துக்கோங்க. அந்த noteல ஒரு separate pageல So in the lung volume and capacity போட்டுட்டு so volume ல என்னென்னலாம் இருக்கு, capacity ல என்னென்னலாம் இருக்கு, formula என்னென்னலாம் இருக்கு, and last அதோட values எவ்வளவு இருக்கு, சரியா? So அப்படின்ட்டு ஒரு 2 பேஜ்ல ஃபுல்லா எழுதி வச்சுக்கோங்க. எக்ஸாமுக்கு முந்தின நாள் அதை வந்து ஒரு go through பண்ணிட்டு போயிட்டு எக்ஸாம் அட்டெண்ட் பண்ணணும். So because this is a memory based question, எல்லா memory based pointsமே பாத்தீங்க அப்படின்னா எக்ஸாமுக்கு முன்னாடி ஒரு 2 times 3 times ஆவது ரிவிஷன் பண்ணிருக்கோம். ஓகேவா? Fine. So the next important point is minute ventilation. So this question also asked so many times in the exam. So what is minute ventilation? See, minute ventilation means amount of air inhaled and exhaled in each minute. Amount of air inhaled and exhaled in each minute, that is called as what? Minute ventilation. There is a formula for this. You can see the formula here. See, minute ventilation is equal to VT. VT, what is the meaning of VT? VT means what? Tidal volume into respiratory rate. So tidal volume into respiratory rate. What is the normal tidal volume for an adult? 500, right? And what about the respiratory rate, normal respiratory rate? That is 12. So 500 into 12, it is giving 6 liters per minute. So normal minute volume is 6 liters per minute. You understand what I'm saying? Because minute volume, minute ventilation, we have to calculate only in the minute. Okay, by means of using the formula, that is VT, that is tidal volume into respiratory rate, and the normal value is 6 liters per minute. Please understand the concept. Okay, guys. So let's move on to the next question. So far we discussed lung volume, lung capacity, formulas, and the values. So now you know what is what. Now we can solve the questions. Whatever the questions so far they have asked related to this lung volume and lung capacity, that question we are going to solve now. Listen the questions properly. So the next question is, the patient is scheduled for pulmonary function test. The nurse explains that during the test, the respiratory therapist will ask the patient to breathe normally. See, actually here the key point is pulmonary function test is going on for the patient, and the respiratory therapist saying that breathe normally. No need for deep inspiration, no need for deep expiration, nothing. Breathe normally, peacefully. Okay, so now we can see the options. 4 options they have given here, that is tidal volume, residual volume, total lung capacity, and vital capacity. 4 options they have given here. Among this, according to this, which is the main key point in the question, breathe normally. Breathe normally means a normal inspiration and normal expiration. If a normal inspiration and normal expiration is there, then it is called as what? It is called as tidal volume. You understand what I'm saying? That is called as what? Tidal volume. So what is tidal volume? So you know that normal inspiration and expiration in a single breath, it is called as what? Tidal volume. And the average tidal volume for an adult is 500 ml. These things you already know that, right? So the 500 ml is further categorized into 2 types, that is 150 ml and 350 ml. 500 ml I'm going to divide into 150 ml and 350 ml. 500 ml எப்படி divide பண்றேன்? 150 ml தனியா divide பண்றேன், 350 ml divide பண்றேன். இந்த 150 ml எதுக்கு? இந்த 150 ml, it is the air which is present in the dead space. So what is dead space? Here you can see this is the larynx, trachea, bronchi, right? Bronchioles, all these area the air will be present, right? So that is called as what? The air which is present in the dead space. And the air which is present in the alveoli, it is how much? 350 ml. Once again I will repeat, air which is present in the dead space like bronchi, larynx, trachea, bronchioles, that is 150 ml, and the air which is present inside the alveoli, that is 350 ml. Okay, so together it is 500 ml. Okay, very important question. Tidal volume related questions are very common. Okay, very common. The next question is the volume remaining in lung. The volume of air remaining in the lung and airway following a maximum expiration. Okay, following a maximum expiration, amount of air remaining in the airway. This is the question. Okay, direct question, and they have given 4 options like vital capacity, residual volume, tidal capacity, total lung capacity, and here the right answer is what? Residual volume. Already we discussed the definition. What is the meaning of residual volume? See, residual volume means amount of air remaining in the airway after the maximum expiration. Maximum expiration, underline the key point. After maximum expiration, amount of air remaining in the airway. That's it. Okay, so that is called as what? Residual volume. Okay, so mostly this residual volume, you know, it cannot be measured in the spirometer. This is very important question. This question already asked in JIPMER examination. See, this residual volume cannot be measured by the spirometer. So what is the spirometer? You can see very clearly in this image. I have given the image of the spirometer. Actually 2 types of spirometer is there. One is 3-ball spirometer. I have given the image here. Okay, in this 3 balls are there. One more type of spirometer I will be showing in the next page. So what is spirometer? Why we are doing this? It is the test, otherwise pulmonary function test, to find out the capacity of the lungs. We are using the spirometer for the pulmonary function test in order to find out the capacity of the lungs, whether there is any obstruction, partial obstruction, full obstruction, or there is no obstruction. Okay, and what is the capacity of the lungs? These things we can easily find out by means of using what? Spirometer. Okay, and the spirometer, in the spirometer we cannot measure the residual volume. Please underline this key point. Okay, you can see very clearly whatever I have mentioned, all those important golden points are mentioned here also. Okay, see, image-based questions are very common nowadays. See, these kind of spirometer we are very well known, we are using in the hospital, right? This 3-ball spirometer we are using in the hospital, but a single valve spirometer is also there. Okay, you can see here. Just look at the cursor where I am showing. Okay, so this is a single valve spirometer. Here also the markings are there, like 500, 1000, 1500, up to 4000 it is there. Whereas in 3-ball, each ball container, it is having different capacities. For example, the red color, the first container, the capacity is 600 cc. Cc in the sense ml. The second container, the capacity inhalation value is 900 cc. The third one, the capacity inhalation value is 1200 cc. So these three things are also very, very important for the exam. First container, the capacity, the inhalation value is 600. Second one, 900. Third one, 1200. Okay, so this is the 3-wall spirometer, 3-ball spirometer, whereas this is the single one. Okay, here the minimum one is 0, maximum one is 4000. Okay, guys, fine. So the next question is the largest volume of air which can be expelled from the lungs after the maximum expiration is called as. See here, maximum volume of air that can be expelled from the lungs during the maximum expiration. So here the patient is doing the maximum expiration, and during that time, how much amount, largest volume of air it is going out. Okay, so this is called as what? Tidal volume, residual volume, inspiratory reserve volume, and expiratory reserve volume. Okay, so this is the direct question, and here the right answer is what? Expiratory reserve volume. Option D is the right one. See here the patient is doing what? A normal inspiration followed by that maximum expiration. What is that? Maximum expiration or maximum exhalation. Okay, so these key points are present means immediately you can go for what? Expiratory reserve volume, and the rationale I have given here, just go through it. The normal value also I have mentioned here, that is 1200 ml. Okay, fine. So the next question is the maximum volume of air that can be expired after the maximum inspiratory effort. See, in the previous question, what it is? The largest volume of air which can be expelled from the lungs during the maximum expiration. During maximum expiration, maximum volume of air that is expelled. Okay, whereas in this question, there is some changes. That is, here also maximum volume of air that is expelled after a maximum inspiration. Here, the expiration is also maximum, inspiration is also maximum. Both are maximum. Whenever the both are maximum, inspiration and expiration both are maximum, these key points are there means immediately you have to think about what? Vital capacity. Expiration also maximum, inhalation also maximum. Two key points. Immediately you have to think about what? Vital capacity. Is that clear, guys? Clearly I have mentioned in the rationale, vital capacity is the maximum volume of air that can be exhaled from the lungs after a deep maximum inspiration, and the normal value also I have mentioned, that is 4800 ml. What was the session, guys? Hope everyone understand the concept, right? Definitely you will be getting questions from here. So this is only part 1. This is not the end of this video. Okay, so I'm going to continue the lung volume and lung capacity in the next class also, because it is little vast. You have to understand the concept. Okay, so watch the video again and again, and if you like the videos, please like it, share it, and subscribe the channel so that it will be motivating for us. And thank you very much, and all the best for your upcoming examination, guys.